I am Nipal Bellmonde, and I live in the Woodland, Texas. In 2017, I was in a very traumatic car accident, and I was having issues with my spine. A local orthopedic surgeon suggested I have a consult with Dr. Roth and perhaps start with a breast reduction, because that was creating a lot of unnecessary neck pain, and we were really trying to avoid a spinal surgery. So I came in referral from another doctor and then just fell in love with the practice, and I've been here since. He has a heart for his patients, and by that I mean I had a procedure booked. It was completely paid for, and I was within the time limit to where you could get a refund. And it was in 2020. I was diagnosed with cancer, so I had to place the procedure on pause. And he could have easily have said, well, you're in penalty, but he didn't. And he said, I will do whatever you would need and want me to do. You tell me, Nipal. It was a moment where you swallow hard, and I remember looking at Dr. Roth and saying, I'm gonna beat this. I don't care what MD Anderson says. So we're gonna go ahead and keep my money, because when I get through the other side of cancer, I'm gonna come back and have this procedure. And that's just rare to see someone go, you're in penalty, but we're gonna throw that out the window, because right now you just need to focus on beating cancer. And that is a man with a heart, and not just looking at his bottom line of his practice. The very first procedure was the breast reduction and the breast lift, and that was in the fall of 2018. Once that healed, I realized I wanted a little bit more tissue removed, and the 4.5-hour original surgery was in the hospital. He was able to do a revision to the original in office, which was lovely because it was so easy to come in and out, and all of the hoopla of signing in and out of hospitals, you know. So it was very convenient, and top-notch care here. His facility is top-notch. So that was procedure one, medically driven. Then the subsequent procedures was I did a mini arm lift with, I think it's Body Tight, and we followed up with Morpheus to tighten the skin. Then we transitioned from that. I had always wanted to have some corrective surgery after the delivery of my child. So it's a sensitive subject, but women do need to know that there are options if you've had hard deliveries. I had a labiaplasty. I was very, very happy with that. And it just snowballed into Morpheus, Emsculpt, and I've been here since. Very comfortable, because when you are having procedures with your private parts, you're very vulnerable, and I felt cared for. He was very respectful, and ultimately I felt very pretty with the end results. So I'm a bit of a difficult patient when it comes to pain medications, because I'm allergic to so many opioids. So we had to work around my allergies, which he navigated perfectly. I was able to handle high doses of Advil, Tylenol, rotating those, and then medications to address nausea, which I'm easily affected by anesthesia, but he worked through ways to do that process too that didn't create more nausea. So for me, recovery with all of these procedures was a breeze. I received personal phone calls the day of, the night of, and then the next morning. And then thereafter, it was, do you need anything? What is your pain level? Are you nauseated? Is everything working for you? Here's my personal cell number. If you need anything, Nipal, just call. I'm going to be here. I've actually shared my story with colleagues and personal friends. I did have a colleague that came here for her breast reduction, and I also had another colleague that came in for Morpheus and ended up with the Skin Lab and had the one-year membership there and was enjoying the facilities of the Skin Lab, which are wonderful. But I also shared with them that when I was just on the outskirts of my cancer and I had base of tongue, so I was on a feeding tube. And Dr. Roth, when I came in to see him, I had dramatically lost a lot of weight very quickly because I couldn't eat or swallow. And as any woman would be, I was struggling with body dysmorphia. And even though I still had the feeding tube in my stomach, Dr. Roth said, you know, Nipal, let me do Morpheus on your tummy to get your skin a little bit tighter, and we'll do some Emsculpt to get the muscles started in your glutes again, because I lost 30 pounds very, very quickly. And as I said, as a woman in her mid-50s at that point, elasticity is an issue with recovery. And he not only did that, but he did that for free. And there's not a lot of surgeons in this city that'll look at you as a human and say, this woman is really struggling, let me do this for her. And he charged me not one dime. And that again speaks to his character and the love of his patients. So when I share that with women, it's very easy to want to see Dr. Roth, because he cares about his patients, not just as a patient, but as a human.